Hi, I'm Kelly, and this is a third trimester pregnancy update. Let's see, I am now 32 weeks into my pregnancy after multiple miscarriages, and this pregnancy, it's like constantly surprising me. It's never a dull moment in my life right now. So at 28 weeks, I did my gestational diabetes test that everybody always does. And I failed the gestational diabetes test. And this was, I don't know, this was kind of surprising for me. I didn't really expect that I would have gestational diabetes. I've been tested previously, like whenever I was going through all of my workups for the miscarriages, I was tested for insulin resistance to see, like, because PCOS can have a factor in both insulin resistance and also in miscarriages. So I was tested thoroughly for all of that prior to the pregnancy, and my numbers were always great. I was always, like, my glucose was always very low, and insulin resistance didn't seem like an issue for me. But here we are in the middle of pregnancy, and I definitely have some kind of issue with gestational diabetes. And so at first, when I found this information, it's like, it didn't upset me too much because I knew that it wasn't like a really big risk factor for anything bad happening to the baby. It's not, I feel like there's a whole lot of things that could be a lot worse that can happen in a pregnancy. So it wasn't immediately like earth-shattering or upsetting. I was just like, okay, well, what do I have to do now? But as like time has wore on and I've had to try doing the diets, I'm trying medicine now. Like, first I went through 2 different oral medicines, and now I'm on insulin, and it's kind of like it's wearing on me, and it is definitely a frustrating diagnosis I have found. So it's kind of different from, it's not like a scary sort of diagnosis. It's not like, oh my God, I'm afraid for the baby, I'm afraid for the baby's life. It's not like that. It's just kind of difficult in the day-to-day dealing with it, if that makes sense. When I was first diagnosed with it, I was kind of surprised because when you Google it and you look up gestational diabetes, like, a lot of the first things that show up as risk factors are all like obesity and I don't know, like people that, like, maybe, I guess I just thought that it was related to not eating well. Like, maybe people that ate a bunch of, I don't know, carbs and bad stuff. I thought that's what led to gestational diabetes. So it was kind of hard at first because I felt like this must be my fault and I must have eaten the wrong stuff while I was pregnant and somehow caused this to happen. But as I've done research and talked to other people that have it and talked to, like, the dietitian and the doctor, now I've learned that it really, for most people that have it, it has nothing to do with your diet. It has nothing to do with anything that you did. It's all from the placenta. And the placenta is releasing too much hormones or too much of a certain kind of hormone that is causing you to absorb more glucose from your food than you really should. So, once I kind of like got over the guilt of feeling like it was my fault, now I'm like, okay, I guess it's not my fault, it's the placenta. And that's a whole nother deal because my placentas always seem to be kind of on the crazy side. I have a history of a molar pregnancy, which is like a problem with the placenta, and then now this with the placenta. So the first line of defense that usually you start with gestational diabetes is diet. Since the body is absorbing more glucose than it actually needs, the typical first answer to that is, well, let's just consume less glucose. Let's not give the body as much fuel, as much glucose as like we were before. So my first step was to alter my diet, and I actually found, like, in the beginning, I felt like I was already fairly low carb, particularly like my dinner meals were pretty much always low carb. What I found was a problem and was difficult was breakfast and snacks. Oh my gosh, I love pastries and donuts and cinnamon rolls and waffles and pancakes. Oh, I love all that stuff. And all of that is too much carbs. So I had to start having a maximum of like 45 carbs for lunch and dinner. And for breakfast, it's more like 15 or 20 grams of carbs. And that's not keto. It's not like a keto diet where you're having like close to zero carbs. You are still having carbs. It's just you're kind of like limiting them. And also, from what I understand, it's not just about limiting them, but it's about like spreading them out throughout the day. Like, you don't want to have like no carbs and then all of a sudden a bunch of carbs and then no carbs, because that'll cause a spike and that'll confuse your insulin levels and everything. So you want to kind of like evenly throughout the day have the same amount of carbs, from what I understand. Now, having said that, this whole thing feels super mysterious and confusing to me. Like, I've tried researching it, I have talked to a dietitian, I am trying so hard to follow what the dietitian and the doctors and the internet says, and it just feels like I'm not getting the results that I'm expecting. Like, I'm expecting, like, okay, if I follow this plan and I have less than 45 carbs, then whenever I take my blood sugar, it should be good, right? I followed the rules. I did what you said to do. And it's not working. Like, I do what I'm supposed to do, and then sometimes my blood glucose numbers are too high. And sometimes they're not too high. And it's all very confusing because I'm not able to see like a pattern in it yet. Now, I've heard that as you go along, usually like you do start to see a pattern, and you start to see like maybe there are certain carbs that are triggering your insulin versus other carbs. But as of yet, it's all still very fuzzy and mysterious to me. I have not been able to find my pattern. It just feels very confusing. It feels like my body doesn't know what it's doing. And sometimes it's fine, and sometimes it's crazy. So that's where I am with my gestational diabetes. I cannot offer any advice at all on what anybody else that has gestational diabetes should do, because I very much feel like I am floundering and failing at this whole thing. So much so that I started on a long-acting medicine, like a oral medicine called glyburide, I believe it's pronounced. And I tried that one, and that one sent me into like, I would take the medicine and I would go into hypoglycemia. Like, my blood sugar would go super low, and then it would go up, and then it would go super low. So that one was way too, that one was too crazy for me. So then I switched to metformin, which is, I think, the more common oral medicine that most people get for gestational diabetes. And I was on that one for a while, and that one did not send me into the crazy, like, up and down spikes. But it was like, after a while, that one just wasn't enough. It worked in the beginning, but then after about 2 weeks, it was like just not cutting it, and my numbers were over the threshold all the time. Or not all the time, but consistently over the threshold. So now I am on insulin shots, which is not a big deal to me because I'm already taking Lovenox, and I've been taking Lovenox for years. So I am very much used to needles, and they do not scare me. So now I just have 5 shots a day instead of 1 shot a day. But I don't know yet how the insulin is working. I have just started it like today. So I can't tell you if that is working better than the oral medicine. But from what I understand, it's supposed to work better, or at least you can like increase your doses if it's not working better. So that's where I am on this gestational diabetes thing. I also found out, I went to the doctor this week, and let's see, so week 28 is whenever I was diagnosed with gestational diabetes, and now I'm week 32, so it's been 4 weeks. And they did an ultrasound this week, and the baby was 5 pounds, which is apparently pretty big for where I am right now. The nurse said that normal, like the normal range for these weeks is something like 3.5 to 4.5 pounds. So I am outside of that normal range, and I'm thinking that's all because my numbers have been too high. My blood glucose numbers have been too high. Because from what I understand, if you have too much glucose that's circulating throughout your blood, the baby starts to consume it, and it's basically just like sugar for the baby, so the baby gets plump and fat and gets extra big. And I think that's really the main risk factor with gestational diabetes, is that your baby will be extra large, and so it's harder for birth, which is very scary for me. I do have one daughter that I had 11 years ago, but she was born 6 pounds 6 ounces, so that's what I'm used to, and that's what I feel comfortable with. I feel comfortable with like this 6 to 7 pound range. If we're getting bigger than that, I'm kind of scared. So yeah, that's a little unusual for me and doesn't make me feel too confident about the labor. But the doctor is watching me closely, and I think he said that if it looks like the baby's getting bigger, or if it looks like there's any sort of issues whatsoever that's going on, we can induce early. He said he's basically not afraid to induce me early because of all of my like risk factors and just my previous issues. He said he would rather, if anything is looking like it's not going good, then he would rather have the baby on the outside because it's easier for everything to be taken care of that way. And I have also read that in Dr. Beer's book, the Is Your Body Baby Friendly? He says that for his patients that have had multiple recurrent miscarriages and that have like autoimmune or just like immune issues that are causing their miscarriages, he has found that it is better to induce early because towards the end of the pregnancy, the placenta can particularly become, like I guess it's just not as good at nourishing the baby in patients with immune issues, and the placenta starts to kind of like degrade and not be the placenta that you really want to have. So that's what he recommends as well. While I am technically 7 weeks away from my due date, I think it's probably going to be less than that before we actually have a baby. I'm not sure exactly when, and that kind of feels like really iffy and really unsure because it'll probably be early, but we're not sure how early. So who knows at this point. I can say that going through multiple losses before this pregnancy, I do feel like it has better equipped me with coping with like these things that pop up in pregnancy, things that aren't like maybe aren't anticipated. Maybe they're not really things that you particularly want. Like I don't really want to have to not eat my donuts and my chocolate and my sweet carbs. It's not fun, but I feel like it's a little bit easier for me because of what I've been through. I feel like I have better perspective and I'm able to say like, okay, whatever I need to do to get through this pregnancy to have a baby that is alive, then I'm okay with it. And that has helped me in some of the like bleaker times of this whole diet thing. Because there have been times when I've been really upset about not being able to eat what I want to eat. It's just like, it's such a small thing. Like, you know, I feel like it's not a big deal because it's just for a couple of months, and it's just like, I can't eat this stuff for a couple of months. Like, what's the big deal about it, right? But sometimes when you're just hormonal and super sensitive, and then all of a sudden you have to think about what you're going to eat, and it can't be the things that you would really like to eat. It has to be something that's like in this very narrow, like this very narrow selection of food choices. It's like really gotten me down sometimes and really frustrated me sometimes. But I feel like when that does happen, I'm able to come back to, well, this is where I wanted to be. I wanted to be pregnant. This is exactly what I have wanted for so long. I need to just be happy and be okay with however this pregnancy, like whatever this pregnancy throws at me, I need to just be okay with it. Because I am super lucky. Like, I still have a baby. Sure, I can't eat donuts, but I have a baby, so that is okay. Because a year ago, I would have gladly given up anything. Like, if you would have told me I had to give up all food in order to have a baby, I would have said, okay, fine, sure, you know, I won't eat anymore. That's how badly I wanted a baby. So sometimes I just have to remind myself where I was a year ago before I was pregnant. And then when I do remind myself of that, it's like, okay, all right, I can do this. It's just for a couple more months. Then I can have my donuts after I give birth. So it's okay. So that's where I am with this pregnancy and with this new diagnosis. I'm still very much in the beginning phase of figuring it out. If I do kind of figure it out and understand what works for me, then I might do an updated video to like help other people figure out how to get it to work for them, because man, it is so hard for me right now. And finding foods that taste just as good as some of those carb foods is really hard for me right now. So I'm gonna really work on it. I'm gonna really work on getting some better recipes and finding better options to where it doesn't feel like I'm just eating nuts and meat all day, which it's really not fun eating meat all day long. So that's it for this update. Oh, okay, before I go, I will give you a bump update, I guess. So my bump is like massive right now. The baby has taken over my body, and it is growing like crazy, and I am actually losing weight somehow, but my belly is still growing and the baby is still growing. So it's big, I'm warning you. There it is. It's huge. It's massive. It's like coming out from all of my clothes, and like nothing can contain it anymore. Hopefully I can get control of these numbers and get the diabetes under control so that the belly stops trying to take over the world and it's just kind of like a normal belly and not so huge. Thanks so much for watching today, and I wish you hope on your journey wherever it may take you. Oh my God, it's huge.